Okay, in this video, I want to talk about this move of getting into your trail side hip. I want to talk about the physical restrictions that make it hard for some folks to feel what it's like to actually coil and turn into this hip anytime they're trying to work on backside pressure, getting the weight over this trail side, and doing it without creating compensations. It can be a difficult move to get right. A lot of times it feels like we're getting to the right spot, but we're not. And I want to talk a little bit about how we can make that easier, what it should feel like, and then how we can translate that back to the golf swing. Okay, so first let's talk about the ground reaction forces of this, or what is it that we actually want to happen while we're turning into this trail side. At the ground, what we expect is that we're shifting pressure over to this side, and what it should feel like is like the weight's going into your trail side heel. So we want to know what it's like to actually load and put weight, center of mass, into the right heel. So not just into the right foot, but towards the back side of the foot. While that's happening, we're pushing off this lead side. So eventually we push off enough that we are absorbing forces into this trail side. And now we have to ask, is there any sort of restrictions or mobility restrictions that are making this more difficult? Here's some things that could happen. If we don't have good foot supination, or where the arch of the foot rises up towards the ceiling without the foot actually lifting up or tilting towards the side, it's just a natural movement of the arch of the foot. If we don't have good supination, which is essentially us loading or absorbing forces into the side, then we're going to get that common foot tilt. So we might have good supination or the ability to supinate in this foot, but we don't know in a golf swing, while we're trying to focus on many things at once, to keep that inside edge of the foot down and allow this true supination to occur. So either a mobility restriction or just a motor control issue. A big one here, not having the appropriate internal rotation of this pelvis and hip. So this hip joint, we want the pelvis to be able to rotate into it like this, creating an environment of internal rotation here, right? When it's all said and done, the hip is in a more internally rotated position here than it is here. We need to be able to do that while rotating and putting forces onto this side. So it needs to be able to handle the force and have the mobility to do that. Belt buckle towards hip. There's a few things that we want to happen while we do that. A lot of it has to do with the hip capsule and the muscles around that pelvis. So if we can't do this, then again, we might have the inside edge of the foot come up to kind of free up that hip to be able to rotate out, instead of keeping that foot closed down and supinated. But also, if we have restrictions here at the hip, bony restrictions or muscle restrictions, that'll stop you from coiling and turning into that hip well. And if we just don't understand or appreciate what it's like to actually pull ourselves into the side, so a motor control issue. These are common things that could restrict you from doing a really good job of getting and turning into that trail side hip. That common compensations that we talked about is that foot tries to come up, that inside edge tends to flare or raise up towards the ground. Or, especially if there's a hip problem, we tend to start to stand up, right? So if there's a hip mobility restriction or even a T-spine rotation restriction, which I find a lot of times is that we get this, what ends up being like a reverse spine angle. So instead of turning in through here, it doesn't like to load into this trail side. Then all of a sudden we stop loading into that trail side and we start putting weight back over towards the lead side. Now we have this tilt towards the target and we're really not loading or coiling into the side. So there's a lot of different reasons why this will start to happen. We'll start to come up out of our posture. We maybe even come up out of our posture and start to reverse spine angle. Right, it's not what we want. So how do we go about making this move and focusing on this action a whole lot easier? Addressing the physical restrictions. So let's talk about a few movements that can be difficult to master, but it's worth the effort to really get a good understanding of what it feels like to actually go deep into this hip socket and do so without compensation at the foot or at the trunk. This is the kickstand hinge. For this position, what we're going to be in is a split squat position, soft bend in this lead side foot, and then 99% of the weight is in this forward leg, right? So we're kind of just balancing up here on our toes. Where a lot of people have issues with this drill is we're not finding the back of the hip like we should, and that's because as we start to go down, people are putting more weight into this back side, which is going to get more hamstring out of it. So to really get into the spot that we're looking for, you have to stay forward and keep this weight forward. So the kickstand hinge. This is our position. I like to go opposite hand in the front of the hip of the forward side leg, and then the same side hand kind of feels the spot that I want to feel working really hard. So it's almost like this hand is pushing this hip backwards as we hinge down, down, down. Spine stays as spine stays as long and as straight as we can get it throughout the movement. So we're here, soft bend on the knee, all my weight's forward. I'm going to hinge from the hip, but this knee angle never changes. So as I go down, this knee never moves forward, and as I come back up, this knee never moves back. So wherever the starting position is, right over the laces, about knee over laces, that's where it stays. From here, we hinge, we're staying as long through the spine as we can. Head goes forward as the hips go back. And then once we load into this part and it starts to go into the hamstring, we stop. So we stop before we load into too much hamstring. The entire purpose of this position, this drill, is to get as much load in the back of the hip and into this glute as we can. Think about it as working the glute, but also lengthening it as we do it. And you should feel this kind of gross sensation, this burning happening here in the back of the hip and into the glute, and that's what we're searching for. We want to teach you to hinge into the back of that hip again and into that glute, as opposed to getting all low back and hamstring working through all this hip extension positions. Okay, so that is the kickstand hinge. These positions are very important. Don't let this knee move forward or backward at any point throughout the movement, and we're searching to find this. One way to help find this if you're struggling and it stays more hamstring is to, again, stay as tall as you can, keep that knee angle the same. As you hinge down, if you're struggling to find it on the way down, that's okay. That's normal. What I want you to do is get down to a position here and think about squeezing or squishing, melting that foot down into the ground. You're pushing 10 out of 10 hard that foot into the ground, and that should help you feel this muscle here start to kind of turn on and work. I want you to keep that 10 out of 10 max effort pushing, melting the foot into the floor as we slowly start to unhinge and come back up. That should really turn on and kick on that back of the hip. And again, like I said, the number one problem where people get more hamstring than glute is because as we go down, we start to kind of lose our weight into this trail side leg, and then we struggle to find hip. So make sure you're staying forward and keeping all that weight forward, almost like you could lift this foot up if you really needed to. Okay? And that is how we start to get into that back of the hip. Create some length through the structures here in the back of the hip, and then again, strengthen the glute through the length of the glute. Go ahead, give it a shot. Okay, this is our lateral hinge to acceleration drill. We have a small platform here, about this high or even a little bit smaller. We're going to put the opposite side or far side foot flat to the platform. This close side foot is going to reach back, away, and down. Now the key with this position here, this feel, is that the inside edge of this foot always should keep some pressure and some weight in it. So think big toe and the inside edge of that right heel has to stay down, and then we pull ourselves up and out of it. So I think we're reaching. This hip is almost like it's poking out of the socket here towards the side. I keep weight on the inside edge. I feel this really lighten up and working hard. As I reach down, 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 I get some quad, and then I extend everything and bring this knee up, up, up. Okay? So we get this almost big stretch, but also a big contraction, a lot of effort as we reach down and away. And we try to be quick on our way back up as this knee comes up and towards the ceiling. Should feel that lateral backside of the hip, as well as a little bit of quad if you're really reaching down through there. Make sure that foot doesn't change or lift up off that inside edge as you start to reach. Okay, go ahead, give it a shot. Okay, this is our into hip kettlebell swing. To start the drill, we're in this split squat position, which looks like this. All my weight is on the forward leg. What we're gonna do from here is essentially a kettlebell swing, but off to the side. So we stay in this split squat position. The key with this is keeping your weight on that forward leg, starting with a soft bend in that knee, and then keeping it kind of as we go in and out of this hip flexion and extension. Okay, the key with this is this belt buckle. This is the way I like to think about it. The belt buckle follows the kettlebell. So think that this belt buckle has eyes and it keeps following the kettlebell as we swing in and out. What that does is it encourages this pelvis to rotate on top of this hip. So we've stabilized the lower half. The foot is grounded. It's not allowed to move. You're not allowed to reach or come out on the outside edge of your foot as we spin the kettlebell into our hip. It has to stay grounded. A great cue here is keep weight on the inside edge of that foot the whole time, and that forces you to turn through the pelvis on top of that hip. So we get to drive this great internal rotation here at this hip joint, and then we get to teach that hip to be strong through that range of motion, to be able to take force, dynamic force and speed into that hip, stop it, and then get it back out. So we improve the durability through that rotation into that hip and the performance of that hip. We also get this great supination and pronation happening at the foot. The femur starts to rotate, the tibia has to rotate below it. We have to stabilize through the knee. It's a fantastic drill for teaching you to move through the transverse plane or this rotation in the lower half. Now, the trunk can rotate with you, but when we think belt buckle towards kettlebell, this forces us to make sure that the pelvis is really doing most of that rotation, and then we can turn through here all we want. What some people will do is turn more through the spine without moving the pelvis, which is kind of defeating the purpose of the movement. So think belt buckle first, okay? You'll feel the outside and backside of this hip really light up to complete that drill, and that we can do for reps, and then we can work up with a heavier weight in our hands over time. So we get more force that we have to slow down and speed back up. Okay, go ahead, give it a shot. All right, I hope that was helpful. We talked about this move, coiling into this trail side, getting into this trail side. Talked about the things that can hold you back. A foot supination issue could even be a tibial internal or external rotation issue as well. Hip internal rotation restriction. Some of the compensations that you'll see if some of these things are present. Inside edge of that foot wants to come up as we coil into that trail side. We'll start to maybe stand up instead, and we might even get a reverse spine angle as we try to not actually turn and load through the side, right? So those are three things that are common when we start to have restrictions on the side that stop us from doing a really good job. And the third thing is just, it's hard to get right. So it's hard sometimes for folks to feel like they can get deep and access that deep hip. This is true for even lifters and exercisers who want to use the glute muscle to create a deadlift or a turn or create some force. And a lot of folks really struggle to use these deep and the outside big muscles of that hip to create movement and to allow for movement. So if we can't feel these big muscles working, it's really hard to master that position and be comfortable there. So the movements that we showed you in this video can be technical and difficult to work through. They're some of the best ways to get really good and comfortable and strong at hinging through that hip to make this weight transfer in the backswing comfortable and really effective and efficient. All right, I hope that helped.